every morning spent with us. We will take care of you. For every pain and suffering you endure, we will take care of you. For every yesterdays and tomorrows you spent alone, we will take care of you. For every moment you long for home, we will take care of you. Because we do not only cure, we care for you. You're more than just a patient to us. You are our family.
We are healing professionals, trained by science, molded by experience. We are in the practice of proactive healthcare. We dedicate our lives to you, and in the process, we ourselves become better. ManilaMed, only our best to make you feel better.
Sa ManilaMed Healthline. Sa lahat ng mga viewers nating sumuong o kaya nabahaan ako, we all hope that you guys are all safe. At bumabagyo man nung maaraw ang panahon, one thing's for sure, ManilaMed Healthline ay narito pa rin at naghahatid sa inyo ng mga iba't ibang health issues. At kung napag-usapan natin, last episode ang patungkol sa cervical cancer, it's just but right to talk about the type of cancer na nakakaapekto sa ating mga kalalakihan. To know more about our topic for this afternoon, let's all watch this video. Para lalo pa nating maintindihan ang patungkol sa prostate cancer, here with us today is an expert pagdating nga sa prostate cancer. Let's all welcome Dr. Arturo Castro Jr., isang urologist dito sa ManilaMed. Hi Doc, good afternoon.
Hi, good afternoon Hannah. Good afternoon din sa mga lahat ng nagpa-participate sa Facebook Live telecast ng ManilaMed.
Ayan.
I'm happy to be here and to talk about prostate cancer.
Ayan. Thank you so much, Doc, for sitting with us today and sharing your knowledge patungkol sa health issue nito. And of course, sa lahat ng ating mga viewers, don't forget to type your questions or your inquiries sa ating comment section below because Dr. Castro will answer it live na live. We'll have an open discussion about it. So, to start the discussion, Doc, ano po ba yung prostate cancer in the first place?
Well, tama yung video that you showed earlier. No? Prostate cancer is the abnormal growth of cells within the prostate gland. Let's start with what is the prostate. Yung prostate ay parte ng daanan ng ihi ng isang lalaki. No? Ito ay may silbi sa katawan. Yung ating sperm cell o yung similya ng kalalakihan, ito ay lumalangoy sa likido or liquid na nanggagaling sa prostate. Actually, 50% of that liquid comes from the prostate and another 50% from the vas deferens. So meron siyang silbi sa katawan natin. Yun nga lang, katulad ng ibang parte ng katawan, kapag tayo ay na-expose sa carcinogens, maaaring magkaroon ng pagbabago na nagkakaroon ng cancer cells na tumutubo dito sa organ na ito.
Ayun, you've mentioned nga po yung carcinogen, which is a huge factor then of why we get cancer po. Ano po yung mga iba't ibang posibleng pinagmumulan ng prostate cancer?
Well, we all know that this has a high hereditary risk, because if you have a first-degree relative that has prostate cancer, you are 6 times more prone or at risk to develop prostate cancer compared to someone who does not have. And yung studies basically that has been done to trace prostate cancer centered on diet. They studied yung mga Japanese who stayed in Japan and Japanese people who migrated to the United States. They found out the Japanese people who stayed in Japan maintained a low risk for prostate cancer, 17%, which is common among Asians, Filipinos included. But Japanese who migrated to the United States, they developed a 33% risk of developing prostate cancer in their 60s. And they attributed this to the food, the diet, the Western diet, rich in cholesterol, high fatty content, and of course, yung mga preservatives within the food.
Ayun. So, Doc, you've mentioned yung mga diet. Siyempre kapag diet, niugnay kasi natin yung obesity. So, does it mean na risk factor din yung mga taong obese and they're more prone to having prostate cancer?
Yes, obesity is a risk factor in developing prostate cancer. So, that's one of the risk factors actually. And of course, unhealthy habits like smoking or too much alcohol intake. So, this predisposes people to developing prostate cancer.
Pero in terms of their lifestyle, kapag you are a smoker, are you also prone to prostate cancer as well?
Yes. Smoking predisposes males or people who smoke to a lot of cancers, not just prostate cancer but also lung cancer.
Ayun. Doc, when it terms na, at pag-uusapan na po natin yung senyales at sintomas, ano po ba, how do we define it? Pag nakita natin itong mga list of signs and symptoms, is it already parang, ano pa yung mga indicators?
Well, as shown in the video, early prostate cancer does not have any signs or symptoms. Maaaring walang maramdaman ng isang tao kapag ito'y maaga pa. Advanced prostate cancer can manifest as hematuria or umiihi ng dugo, pelvic pain or bone pain, masasakit na mga buto kasi kalat na ang prostate cancer, and of course, pagkakalat na ito sa atay, jaundice, and pagkalat na sa baga, hirap ng paghinga or ubong hindi gumagaling. So these are the possible signs and symptoms of advanced prostate cancer. So since early prostate cancer does not actually manifest any signs or symptoms, we recommend that patients, male patients, age 40 and above, undergo annual checkup with their urologist. So this would screen them from possible prostate cancer.
Okay, so wala naman pong sobrang sakit na nilang nararamdaman in terms
Well, pag advanced na yung prostate cancer, bone pain, is the most exquisite pain na maaaring maramdaman ng may prostate cancer, Masakit lumakad, masakit gumalaw. Some of them are actually bedridden kasi talagang nagkakaroon na ng spinal cord compression.
Ayun. Doc, how young na pwede natin ma-diagnose ang prostate cancer?
Well, the prostate cancer is usually diagnosed at around the age of 65 and above, but it can occur actually at any age. In fact, younger patients tend to have a more aggressive kind of prostate cancer.
Bakit po kayo? Is it because of their lifestyle?
Well, it's just probably a coincidence that yung mga medyo high aggressive na prostate cancer are seen in young people.
Okay. Doc, paano ba natin maiiwasan ang prostate cancer?
Well, prostate cancer prevention is mainly also healthy lifestyle. There are some food that has been identified to prevent prostate cancer, like yung mga soya or tofu because of yung sa mga isophenols na laman nito.
Yes.
And of course, yung mga tomato-based food or tomato-based products, tomato paste, which are rich in lycopenes. And also, yung ating green tea has been identified to be cancer preventive when it comes to prostate cancer.
Ayun, Doc. Doc, I'm just curious kasi 'di ba syempre once you were diagnosed with prostate cancer, may chances pa po ba na makaano ng bata or makapabuo pa po ng ganun?
Well, yung prostate cancer, once you are diagnosed with it, as long as you are still capable to ejaculate, kung hindi ka pa na-opera, hindi ka pa na-radiation therapy, your fertility is not actually compromised. Pwede pang magkaanak. But kapag ka ginamot ang prostate cancer sa pamamagitan ng pag-opera, maaring magiging mahirapan na magkaanak in the natural way ang isang lalaki. Kasi prostate cancer treatment, yung tinatawag namin operasyon na radical prostatectomy, kung saan tinatanggal yung buong prostate, natatanggal din nito yung mga nerves responsible for erection. So, maring hindi na makapagtalik ng maayos ang isang lalaki after the operation.
In terms of gamutan naman po ng prostate cancer, ano po ba yung mga different ways?
Well, ang prostate cancer, if detected early, actually isa ito sa mga kakaunting uri ng cancer na pwedeng curable, no? If detected early at organ confined, nasa loob lang ng prostate yung cancer cells, pag tinanggal yung prostate, cured na yung pasyente. Ibig sabihin yung posibilidad na siya ay mamatay dahil sa prostate cancer ay halos zero na. So, ang ibig sabihin nito, he might die of some other diseases later on, no? Probably heart problem or some other, chronic diseases. But yung dying of prostate cancer, you could actually rule that out kapag early na-detect at natanggal yung prostate cancer. So, ang mga uri ng operasyon para sa prostate cancer ay pwedeng traditional, which is yung open retropubic radical prostatectomy, kung saan may isang dangkal na sugat dito sa puson hanggang sa may ibabaw ng buto dito sa ating may puson, no, pubic bone, at doon tinatanggal yung prostate, no, kasama ng lahat ng kulani in the area. Ngayon, may mga makabagong pamamaraan yung tinatawag na laparoscopic radical prostatectomy, kung saan may mga maliliit lang na sugat na kasinlaki ng lalagyan ng susi or susian, mga 6 na ganon, all throughout dito sa tiyan, kung saan dinadaan yung mga instrumento para tanggalin yung prostate na may cancer. So, ito nagagawa natin dito sa ManilaMed. Yung isa pang pinakamakabago ay yung tinatawag na robotic radical prostatectomy. By ilan-ilan lang ng mga ospital dito sa Pilipinas na may ganitong equipment. Pero halos similar naman ito doon sa laparoscopic. Ang kaibahan lang ay meron tinatawag na Da Vinci robot na kung saan ang surgeon ang nagko-control. Tapos yung pinakakamay ng robot ang nakapasok sa katawan ng tao. Ang advantage nito ay mas kita yung object na kailangang operahan, mas kita yung prostate at pati yung mga nerves. Kaya maaaring mas-save yung tinatawag naming veil of Aphrodite, yung mga nerves na nagkokontrol ng ihi at pati yung pagtayo ng pagkalalaki ng isang pasyente. No?
Doc, how treatable is prostate cancer?
Well, if it's detected early, it is one of those cancers which is curable.
Ayun. And how long does it usually take yung gamutan na period po niya?
Well, the surgery of prostate cancer is about 3 to 4 hours. No? Ganun lang kabilis yung pag-opera ng prostate cancer. But recovery, the patient could stay somewhere between 3 days in the hospital or as long as 1 week. Afterwards, I recommend patients to rest for about a month sa bahay. No? Wala munang mga strenuous activities. Refrain from jogging, walking long distances, or carrying heavy objects for a month.
I've noticed, Doc, so hindi siya, no need na for radiation or chemotherapy?
Well, may mga different schools of thought. No? Radiation can be offered in patients with advanced prostate cancer. So it can be given alongside yung hormonal therapy or chemotherapy pagka advanced na yung prostate cancer. There's a kind of radiation therapy called brachytherapy, which is also available here at ManilaMed, which can be offered to patients with early stage or localized prostate cancer. No? Ang prostate cancer ay pwedeng makumpirma sa pamamagitan ng biopsy. So the biopsy will tell us kung anong klaseng cancer ito, no? Yung tinatawag na Gleason score. A high Gleason score of 10, that's the highest. No? Gleason score is somewhere from 2 to 10. The higher it is, the more aggressive the tumor is. So we offer brachytherapy for mga low risk, mga Gleason 6 and below na prostate cancer.
Okay. Aside from brachytherapy, Doc, as you've mentioned, ano pa po ba yung mga available na treatments or diagnosis ng prostate cancer dito sa ManilaMed?
Well, of course, yung ating hormonal treatments, you can approach the urologist here at ManilaMed and the medical oncologist if you are already diagnosed. Then we can discuss your treatment options. If you are an advanced prostate cancer patient na hindi naman castrate resistant, no? Ibig sabihin, epektibo pa yung hormonal therapy, may mga tabletas, yung tinatawag na mga bicalutamide, no? It's an anti-androgen that can be taken by the patient to slow down prostate cancer's advance, no, in the body. And then this can be augmented with injections of hormones, no, yung LHRH, mga agonists, and GnRH agonists. This can be given to patients then who are still hormone susceptible. But when patients are already castrate resistant kasi nagkakaroon ng resistance after a while, yung tinatawag namin na metastatic prostate cancer castrate resistant, then they can be offered yung mga bagong gamot ngayon which are the abiraterone and enzalutamide, no? These medications are actually targeting the receptors for the hormones. So they can be offered for patients with advanced prostate cancer. And of course, yung mga docetaxel, no, for really advanced prostate cancer, chemotherapy can be started.
Ayun. Madami naman po palang paraan to treat
but
it.
It's actually parang Hana, no? Natin, kumbaga algorithm yan. Yung mga early tsaka yung mga advanced. So iba-ibang approaches for that.
Okay, ayan. Thank you so much, Doc, for answering the first set of questions. And sa lahat ng mga viewers natin, i-comment nyo na po ang inyong mga questions and inquiries sa comment section below because after our break, Dr. Castro will answer it live. Ayan, all of these things will happen sa pagbabalik po ng ManilaMed Healthline.
So we climb mountains, I play tennis, and after 5 years of that activity, I felt this pain already on my knees. I felt insecure because yun nga, sasakang-sakang ka doon.
There was a need na mas mahirap talaga yung surgery itself. Mas maraming kailangang i-release, mas maraming kailangang i-cut na bones.
Sabi nga, life is so short, so you have to do anything that you want to do.
A happy patient makes a happy doctor. No?
I had a swollen leg and it was more difficult to walk really because the pain was so severe. That made me stop from many of my activities.
Mrs. Robles was shocked and worried when I explained to her that it's the operation that can save her leg.
Of course, with the very encouraging words of Dr. Dina, I was able to muster courage to face the operation. Lately, after that, I was able to resume my old lifestyle.
Well, I became more sensitive to my patients' personal concerns. I guess I just want them to be happy and healthy.
She had a very rare condition because it happened during pregnancy. Hindi lang siya ang aking asikasuhin, kundi yung ding baby in her womb.
So I prayed for a safe delivery for me and my baby.
It was really a blessing and a miracle actually that we were able to pull her out of that condition successfully.
I like the doctors. I have great faith in them.
I always told them that he is handled by very good doctors here at ManilaMed.
I think that helps a lot. My strong faith in the doctor, in the health workers you have here, I'm very comfortable with them. And this is one thing I admire with the hospital.
Of course, our aim in life is to prolong the person's life.
Because of
ManilaMed,
Life
Feels better.
Well, welcome back sa ManilaMed Healthline at kasama pa rin natin si Dr. Arturo Castro Jr. and we are talking about prostate cancer. Sa lahat ng mga viewers natin, kaka-join pa lang. Nako, good afternoon po. It's never too late to type your questions or your inquiries. Ayan, let's start the discussion, Doc. Galing sa unang question from our live viewer. Sabi po niya, from Ian Dale R. Mendoza, pag mahilig po ba sa mataba na food, nakakakos po ng prostate cancer? Thank you.
Well, Ian, gaya nga na nasabi earlier, no, it increases the risk of developing prostate cancer. But it's not entirely the reason. Hindi ibig sabihin nun, pag mahilig ka sa matatabang food, is 100% sure you will develop prostate cancer. But it will increase your risk. So, maaari itong mag-trigger ng changes in your body that would lead to prostate cancer.
Ayun. Galing naman po kay Davin Bugarin, aside from PSA, what other procedures can help diagnose prostate cancer?
Well, Davin, in order to diagnose prostate cancer, there's a lot of things that come into play, no? Kapag pumupunta ang pasyente sa isang urologist, of course, we interview the patient. We ask him about his lifestyle, kung does he live a healthy lifestyle, does he have unhealthy habits, like, eating fatty food, and of course, engaging in high-risk behavior like smoking, syempre, alcoholic intake, and then of course, yung risk niya will be compounded by his exposure to chemicals or radiation. And then after that, we do a physical exam. Lahat ng lalaki 40 years old and above, if consulting about the prostate, should undergo a rectal exam. No? In fact, this Saturday would be the World Prostate Cancer Awareness Day, and all training institutions like Philippine General Hospital, National Kidney and Transplant Institute, University of Santo Tomas, who has residents or fellows na nag-train in urology, will be entertaining patients, no, from 7 in the morning onwards to do examinations for prostate cancer. So this is a rectal exam. So kakapain namin sa pamamagitan ng pagsundot ng puwet yung prostate kasi maaabot at masasalat ang prostate sa pamamagitan nito. Ngayon, makikita namin based sa aming pagsalat kung meron ngang posibilidad na may cancer ang isang pasyente. A normal prostate has a consistency just like your cheeks, no? Kasi lambot lang ng pisngi. Kapag ka ganun, normal 'yon. Ngayon, kapag ka namamaga or may prostatitis, kasing tigas ng ilong, yun ang mararamdaman namin pag sinasalat. And then, yung mga may prostate cancer, kasing tigas naman ng siko. So, yun yung mga bagay-bagay na ginagawa para ma-increase yung index of suspicion kung may prostate cancer nga ang pasyente or wala.
Okay.
Ngayon, PSA would come in last. That is a blood test which is a tumor marker. Hindi ibig sabihin na kapag ka-abnormal ang PSA ay may prostate cancer na, no? Kasi nga, it can be elevated due to some other things. Kapag kamaga ang prostate, maaaring mataas ang PSA. Kapag ubod din ng laki ang prostate kasi, napag-aralan na yan, na kapag nag-edad ang lalaki ng 40 years old and above, starting 40, ito ay lumalaki o nag-i-enlarge dahil sa pagtanda. No? It's the effect of aging. Ngayon, if it's too enlarged, pwede rin tumaas ang PSA. So, I usually approach it this way, no? Especially kapag ka mga nasa 10 or below 20 yung PSA lang naman, I treat my patients as if he has an infection or an inflammation of the prostate. I give the patient an alpha blocker and a fluoroquinolone for about a month, and then repeat the PSA after a month. And usually pag bumaba ito, then no worries, it was just prostatitis. Pero pag nanatili itong mataas, the next step would be a prostate biopsy. The prostate biopsy will be the actual confirmation kung meron ngang cancer o wala. Ang ating prostate ay Hughes triangle, no? At dalawang pisngi ito, the left and the right side. The biopsy is 12 core. Ang ibig sabihin nun, kukuha ng dalawang pirasong laman sa tuktok ng pyramid or ng triangle, dalawa sa kalagitnaan at dalawa sa base. Per side yon, 6 sa right side and then 6 sa left side. Itong mga laman na ito ay papadala sa pathologist, yung doctor sa laboratory, para ma-interpret kung cancerous nga or hindi. And then he will give the Gleason scoring. Sasabihin niya how aggressive the cancer is. Sa Europa at sa United States, may panibagong test na to detect or to increase the suspicion of prostate cancer. Ito yung PCA3. It's about 500 euros. No? You can import that test. Ang gagawin naman is magpro-prostatic massage. No? Susundutin ng puwet, mamasahiin yung pinaka-prostate, and then yung ihi ng pasyente ay titingnan kapag mataas yung levels ng positivity nito with the PCA3, then mataas din yung possibility of prostate cancer.
Ayun. Doc, yung PSA, meaning it's, yun yung prostate-specific antigen, ano po ba yung normal count po ba niya, if ever?
The normal value is actually 0 to 4 no, in most of the machines that detect PSA. So, but it can vary. Like in some other hospitals, it can be lower. But generally, it's 0 to 4.
Ayun, thank you so much, Doc. Another interesting question po, galing po kay Jen Gata. Bumabalik po ba yon? Kasi may kakilala po ako 3 beses na na-opera pero hindi naman daw po cancer.
Well, Jen, yung sinasabi mo, yung sinasabi ko earlier na dahil sa pagtanda, nag-enlarge yung prostate, no? Yung tawag dyan ay BPH or benign prostatic hyperplasia. Lahat ng kalalakihan, when we age 40, magsisimula ng lumaki ang prostate. And then about, in our late 50s or early 60s, it will manifest as a lower urinary tract symptom, no? Ito yung parang hindi lahat nauubos kahit tapos ng umihi, parang bitin at may natitira pa. Or pag nagtra-travel, no, from Manila to Batangas, hindi makakaabot ng Batangas na hindi huminto sa mga gasoline station, ihi ng ihi, no? And then mapapansin ng kalalakihan at this age, hindi na ganun kalakas ang daloy ng ihi. Parang medyo mahina na yung flow. Kailangan ng itulak or umire para mailabas yung ihi. And then within a 2-hour period, sobra sa 2 beses umihi. And then yung daloy naman ng ihi, imbis na dire-diretso, paputol-putol. And at night, more than 2 times na bumabangon. Minsan napupuyat pa, no? 5 times or more na bumabangon upang umihi. So pagka-enlarge na ganito ang prostate at may mga sintomas na nahihirapan sa pag-ihi, pwedeng gawin yung tinatawag na transurethral resection of the prostate or yung makabago ngayon, yung laser resection of the prostate. No? Yun nga lang, kahit na bawasan mo yung laman ng prostate, kayurin mo ito upang lumuwag ang daanan ng ihi. Since ito ay parte ng katawan, it might heal and regrow. So usually in about 5 to 10 years time, tutubo uli ang prostate, maaaring gawin uli dapat yung pagtanggal ng prostate para lumuwag uli.
Ayun. Thank you so much, Doc. Another question from Philip. Sabi po niya, Doc, I heard from a friend na frequent or rather ejaculation decreases the chances of having prostate cancer. Is it true daw po?
Well, Philip, I don't think there's a semblance of truth in it, okay? Kasi there's actually no correlation with sexual activity and developing or preventing prostate cancer. Maybe it's some just ingenious way of some people to convince their wives to do the thing.
Okay. Thank you, Doc. Another question from Angelo. I am 40 years old and is currently diagnosed with early stage of prostate cancer. Will the treatment depend on my age? If yes, what is the advisable treatment at my age?
Well, Angelo, you're rather young to develop prostate cancer. You should sit down and talk with your urologist because our role is not to dictate to you what prostate treatment is best for you, but to lay down the cards, and to let you choose. It all depends upon the Gleason score or the aggressiveness of your prostate cancer. If you have a low-risk prostate cancer, which is Gleason 6 and below, then there are options like yung sinabi ko kanina, brachytherapy. No? Brachytherapy doesn't entail any incision. Walang hiwa ito. No? Patutulugin ka, tapos in the operating room, nakabuka ka. Then the area in between the scrotum and your anus, yun yung perineum na tinatawag, doon itutusok yung mga yung tinatawag na seeds. No? These are usually radioactive gold seeds or iodine seeds na i-distribute throughout your prostate. So this will emit radiation that will slowly kill the prostate cancer over a period of time. So yun ang pwedeng pag-usapan because it has the chance of actually preserving your potency o yung ability to maintain erections rather than the other kinds of treatment. or yung robotic which can preserve the veil of Aphrodite.
Ayun. Another question from Triksha, could there be a potential side effects for those who's undergoing prostate cancer treatment?
Well, yung side effects of surgery, gaya nga ng nasabi, except for the robotic prostatectomy, which has the advantage of preserving the veil of Aphrodite, 50% of patients maintain their erection and maintain continence, no, yung control ng pag-ihi right away with the robotic prostatectomy. With the open surgery and the laparoscopic surgery, medyo mas mababa yung preservation of these. Minsan nagkakaroon ng incontinence. Patients might need to wear diapers for as long as 6 months to 1 year before this recovers and yung control ng pag-ihi ay manumbalik. And then of course, a lot of patients, they suffer from impotence. No? They no longer are able to do erections after the surgery. Ngayon, when we talk about the hormonal therapy, yung mga gamot and injections and for prostate cancer, this has the side effect of counteracting testosterone. So, nagkakaroon ng paglambot ng buto. They are prone to bone fractures. At nagkakaroon ng loss of muscle mass. No? Nagkakaroon ng parang tinatawag nilang sarcopenic obesity. Ang muscle napapalitan ng taba. Okay. So, these are the side effects of the treatments of prostate cancer.
Ayan. At galing naman po kay J. Doc, is there a probability that at a young age, one can get prostate cancer?
Yes, Jay, we mentioned that earlier. No? Prostate cancer usually occurs at 65 years old and above, but it can occur at any age. Kaya nga nung isa nating nagtatanong si Angelo, he's 40 but he already is diagnosed with prostate cancer.
Doc, how young kaya ang pwede nating meron na siyang prostate cancer? Is it even possible na parang teens?
Well, I haven't encountered a teen with a prostate cancer yet, no? The youngest that I've had is about 35 years old. So, and of course, high risk siya because his father had prostate cancer and he had, a really unhealthy lifestyle. So, those are the predisposing factors that made him develop it at a younger age.
Ayan. Galing naman po kay Angel, my father-in-law recently died from prostate cancer. It was too late na nung na-discover na may sakit siya kasi malala na. Should this be an indication that my husband needs to take some prostate examinations or screenings to prevent it? And if yes, how can this be prevented?
Yes, your husband is 6 times more likely to develop prostate cancer than compared to someone who does not have a father who developed prostate cancer. So I recommend that he should visit a urologist so that he can be interviewed and examined.
Ayan. Galing naman po kay Ken, I was recently diagnosed with prostate cancer. I fear na kumalat ito. Advisable po ba ang chemotherapy sa ganitong uri ng cancer?
Ken, we have to do metastatic workup first. We have to verify kung kalat na nga ba yung prostate cancer mo or hindi. Ano-ano ang mga test na pwede natin gawin to find out, no? We can do a CT scan with contrast of your abdominopelvic area para makita kung may malalaking kulani na senyales ng pagkalat ng prostate cancer. We can do a liver ultrasound to confirm kung may mga nodules sa atay na senyales din ng pagkalat doon ng prostate cancer. We can do a simple chest x-ray to find out kung may tama na yung baga ng prostate cancer, and bone scan, no? Para makita kung may mga areas within your bone na pinagkalatan ng prostate cancer. Now, if we confirm that there's actually metastasis or kalat ng prostate cancer in these areas, then I would recommend that you can undergo chemotherapy as one of the possible treatments.
Ayun. So yung pagkalat, Doc, it only happens kapag advanced na yung prostate
cancer?
Yes,
it's only in the advanced stages that happens.
Okay. Another question from Alexandro, may mga dapat po bang iwasang pagkain para hindi magkaroon ng prostate cancer? I think nabanggit niyo po yung taba.
Kanina na pag-usapan yan, Alexandro, na yun nga, yung diet, no? Yung Western diet. In fact, one of our urologists here at ManilaMed, Dr. Matias, during his training at PGH, did a systematic review of literature. Minention niya yon, exposure to Western diet, high in fat, high in red meat, high in preservatives, high in cholesterol, would predispose one to develop prostate cancer.
Ayun. Last question po from David. Kapag po ba kumalat ang prostate cancer, posible ding magkaroon ng iba pang klase ng cancer?
Well, David, yung tinatawag na collision tumor, kung saan ang isang tumor ay biglang makakasalubong o masasamahan ng ibang tumor is very rare. So, kapag may prostate cancer ang isang patient, most of the time that patient will only have that cancer. But since prostate cancer, just like any cancer, can be a very big stress to the immune system and to the body, it might also predispose that patient to develop other cancers as well.
Ayun. Thank you so much, Doc, again for sharing your knowledge and answering yung questions from our live viewers. Siguro po ano na lang po yung mapapayo ninyo sa ating mga live viewers about prostate cancer?
Well, for all males age 40 years old and above, I advise that every year you go to the urologist, visit your urologist, and have yourself examined. No? In fact, we at the Philippine Urological Association do this for free every year during Father's Day. This is our service to our community to help prevent prostate cancer. And this Saturday, it will be the World Prostate Cancer Awareness Day. I suggest you go to the hospitals with training programs for urology, and then the fellows with their consultants will be there to help you and do service in fighting and preventing prostate cancer.
What time exactly po sa Saturday?
It starts around 7 and it goes onwards until all the patients that we see are seen.
Yeah, those programs po are really great to help out our male community po. And at pakibahagi na lang po sa ating mga viewers yung clinic hours and how can they contact you here at ManilaMed?
Well, I stay in ManilaMed, MWF, Monday, Wednesday, and Fridays. They can come see me in my office or clinic at room 314, the 3rd floor. Then they can call the trunk line and have themselves connected to my clinic. And my secretary, Ma'am Edna, will be happy to schedule an appointment.
Ayun. Thank you again, Doc, for sharing your knowledge. I'm sure madami pong napulot na aral ang ating mga live viewers. And sa lahat ng mga live viewers, thank you so much for joining us today with another interesting discussion. Thank you sa inyong mga questions and your comments, and continue to support and watch every episode ng ManilaMed Healthline. At abangan na ang ating susunod na episode at pag-uusapan naman po natin ang patungkol sa pagkakaiba ng epilepsy at seizure sa mga bata. Makakasama na po natin si Dr. Rhea Salonga. That would be on September 21st. Ayan, Thursday po yan at 2 p.m. At kinabukasan, September 22nd, Friday, we are also inviting you to join us with a lay forum sa patungkol sa breastfeeding. And Breastfeeding 101 po yan. Be there ng 11:30 a.m. at Dr. Paulo C. Campos Hall dito po sa ManilaMed. And of course, you may follow us at Instagram, that is at ManilaMed, and of course at Facebook, like our Facebook fan page, that is also at ManilaMed, or visit our website. It's also at www.manilamed.com.ph to keep you updated. Yan at mga iba't iba pa pong mga health issues na ating pang matutuklasan. Dito lang syempre sa nag-iisang ManilaMed Healthline. Muli ako po si Hannah Lapitan, and this has been ManilaMed Healthline. Only your best to make you feel better. Magandang hapon.